All right. So your knee pain, let's say your knee pain isn't getting better. A common question is, when do I seek additional help? Obviously, that first time, if it was traumatic, if you fell off a ladder or house, you landed straight on the knee, or you got hit by something falling, or you were in a car accident and your knee just gets impact. Those are obvious times that we want to make sure that there's nothing broken, especially from those trauma. We want to make sure that there's no major red flags. The other thing that we check for after, let's say it's a non-contact injury, or you do get hit from the side in an activity or a sport, we do check for if your ACL or your PCL, MCL, LCL, we check for your meniscus. We check those things to see if they are torn. So yes, we can check those at our office. We are trained in doing that, and we will almost always do that when we're treating or evaluating a knee, just to rule it out. The ways we know is obviously laxity or severe pain on some of those things. Obviously, it's not an MRI, but basically we can rule out the need for an MRI or the need for an X-ray, which are more costs that are put onto the patient. Another reason that we would seek additional care is, let's say our trial of care, we are just working on this thing. We're 6 visits in, we're really just not getting anywhere. Things seem kind of weird, kind of odd. That's when we would refer somebody for X-ray if we suspected that there may be a stress fracture, or that we may think that there's a torn ligament, and you can kind of see some of those things on X-ray. That's our first step. It's the least cost, so it's the most effective tool that we can send out right away. If we're like, yeah, there's something soft tissue going on here, that's when we might refer to an ortho. They usually have the ability to MRI things on site, and it looks a little bit better if it MRI goes through an ortho sometimes with insurance companies, but we can refer out for MRIs. We do it actually quite often. Sometimes when you come in and we do an evaluation and we something's a little loose here, we may refer out to imaging, but that doesn't mean that we're referring you out of our clinic. It may mean that, hey, let's get a real good read on this. If we come back after that imaging and we're like, yeah, there's a little bit of a tear, but nothing that requires surgery, we can still keep that in office and we can still treat that. We just like to know a little bit more about that, so we know what we're dealing with when we do treat it. Sometimes that we don't refer out of our office when things aren't rapidly changing. We don't see any red flags. That's the first thing. There's nothing there that indicates that we should not be treating this in office. Another thing is, if we see any small wins, we're keeping you in our office, because we believe that if we're having small wins, and when I say small wins, not necessarily just pain or performance, but we see range of motion changes, we see strength gains, things like that, we know we're on the right track. It's just going to take a little bit longer. And soreness and discomfort, they are also not qualifying things that we see in our office that would require a referral out. Sometimes if it's a strain or a sprain, it's going to require some soreness and some discomfort to start to build back those tissues. So if you come into our office with knee pain, trust me, we are looking out for you, and we are making sure that this isn't a thing that needs to be referred out. We're making sure that there's no red flags. We're checking those ligaments. And we might gloss over that sometimes in the evaluation, because we're going through and we're just checking things. And sometimes there's a little bit of a fear. And if we say anything about an ACL, PCL, MCL, sometimes people's meters just go right up.